are back right here on AM Arizona, and do we know what's going on? Probably not, but we do know that Dr. Leisa Grgula is with us. She is a chiropractic physician talking about strengthening our core, keeping the core strengthened. When the core is strengthened, then we're able to, our arms, our legs, everything works a little bit better. We have more strength.
In Asian healing arts, they believe that if your core is strong, your body is strong. So always go to the core first and everything else will follow suit. Yeah.
Define the core.
That's the thing. People used to think it was the belt line or the old girdle line, just of the waistline. But now remember and think about it. The girdle actually went down to the hips, okay? Girdles didn't just go and cinch around the middle. That was a corset.
You know, I miss girdles.
See? Imagine the world.
So do I.
Girdles.
It has been.
Think of all the hours you'd save not going to the gym.
Fine.
But you know what? It hit a lot of flaws, didn't it? I mean, that was what a girdle was for.
Well, the problem with the girdles and corsets, etc., is when they're released, everything comes out.
Everything
the
just
muscles, the muscles have never actually done their job. Now everything looks good.
Yeah.
They look great. You know, they have all the modern techniques now and the tighter lycra and things. But remember, it's about really strengthening. And you spoke earlier about the internal organs and how we want to feel good inside. If our muscles aren't strong around our organs as well, we're also going to get sick. So if we just all look great, we're in a small, tiny size, and we look wonderful in our outfits, that's good. But what's really going on in the
reality,
organs?
Everything's falling apart.
That's right.
Can you tell by feel when you're examining someone if there's something out of whack?
We first of all, of course, we palpate spine, but I also do an abdominal inspection for people as well. Sometimes if they do have an abdominal issue, I have to auscultate, listen with a stethoscope, and if I hear something wrong, they've got to get out to a gastro doctor.
What are you listening for?
Listening for bowel sounds.
Okay.
We have to have bowel sounds in all four quadrants. That's normal, and if we don't, you could have an obstruction in there, and that's very, very dangerous. So we want to listen, especially patients who've had the lap band and some of these surgeries. They want to be sure that everything's going well.
So there should be noise going on in there.
Oh yeah.
Yes.
Oh, yeah.
Now, do you adjust gentle? Do you have a gentle way, or do you pop? See, I love my back just popped.
We do that for some patients.
I mean, I love it. My back
do.
just click, click, click right in. It's just wonderful.
We do for different instances and different conditions.
That.
Certain conditions we don't do that because maybe there's osteoporosis involved.
Right.
Maybe someone's just had a really bad accident and they just can't tolerate that.
No.
Or it's a disc issue and we really have to be very careful of the disc.
Speaking of a disc issue, that falls along the lines of a cervical condition. I don't know the correct word. There's a correct title. Cervical
stenosis.
Okay.
Well, it can be anywhere in the spine where the actual cord or the nerves are starting to shut down and they're getting squeezed by a calcium buildup or because a disc is bulged.
Well, now gentle adjustment, even mainstream medicine says gentle adjustment is good for that.
It can be, yeah. And a gentle, for me, on stenosis, I use the Cox decompression because what we're doing is we're not doing more of a ballistic motion, we're just opening up that area and taking the pressure off the nerve that way.
Which
That's
is
how
what
I
we
treat
need to
stenosis.
do,
Yeah.
isn't it?
Bottom line is take the pressure. That's the body's way of saying you've got pain.
Yeah.
That's why you have the pain to begin with because something's pressing on the nerve. But it's really so much more deep than that.
Yes.
This is the actual Cox technique here. And I'm actually doing low back going up to full spine because in some patients it's not just low back and neck, we're actually doing their entire spine with this technique, especially the osteoporotic individual.
So as you're doing this, what are you doing? Because it looks like you're lifting the legs, moving them side to side. What is that doing?
Well, depending on that patient's condition, if they were to have perhaps a herniated disc off to the right, then I'll swing that table off to the left to open up that right area. That's real important. And then it goes circumferentially because maybe the level above has to be addressed and maybe number 5 is to the right, 4 is to the left. So we actually have to bring it around and use this technique, which the regular decompression machines don't do. This is hands-on, so I can communicate with the patient. I can mark the levels with a grease pencil according to what I find on the MRI or the exam, and that's why we have to go around.
And obviously more treatments, first treatment, second treatment, and then you x-ray or...
No, what we do is we'll go 2 weeks and then we do a re-exam. So the first initial exam that I did, we are going to do again in 2 weeks to be sure that we're going in the right direction. If I don't see 20 to 30% relief, objectively in the exam room, then subjectively with the patient telling me how they're feeling, then I have to change what I'm doing. Then at the 4-week period, our 50% rule is if I can't get you 50% relieved in 4 weeks, I have to send you to another form of medicine to get you some relief at that point.
Now
so
that we have the core strong, now it's time to have some nutritious, healthful juices. And you're going to talk about juicing. We're going to juice something that is kind of a medicine and very good for you. medicine, and then we're going to juice something that we just want to juice just because it
fun,
tastes
just
good.
have fun and just like it.
Yes.
Don't let it intimidate you.
I'm for that.
When we come back, we're going to meet the doctor in the kitchen.